Good afternoon, everyone. I know it would be very difficult post-lunch, and I hope there'll be some sleepy faces around there. I'm Dr. Sanjay. I'm from the GMR group right now, but you might be surprised why GMR group. GMR right now has nothing to do with healthcare, but I'm here from my previous experiences where I worked with neurosynaptic communications and also with a company called Healthways, which is a global leader in disease management. This is one of the quotes that I heard. The world would not have enough money to treat all the incidents of diseases that would occur in the next decade using the existing methods of treatment. We are talking about the burden of cardiovascular diseases, we are talking about the burden of chronic diseases and also the infectious diseases. If you look at all of them needs to be treated at the present conditions in terms of where a cardiac surgery would cost anywhere between 60,000 at Narayana Hrudayalaya to around 4 to 5 lakh at some hospitals in Mumbai. And if all the incidents is put together, we don't have enough money for that. The whole world doesn't have enough money for that. So how do we deal with the existing burden? There has to be a change in practice of medicine itself, is what I would put in as. So in terms of coming to telemedicine as such, keeping that slide in the background where we don't have enough money to treat all these diseases with the existing systems of medicine, what is the vision of a telemedicine? If somebody is establishing, an hospital is establishing a telemedicine center or a disease management center, whichever where the disease management is in Oak right now, what is the primary objective of that? Is it to provide access to the medical care for the patients? Or is it lowering cost of medical care for the patients? Or is it for tracking and monitoring the clinical signs of the patients? Or is it to provide home care? Where is the need actually? Is it a societal or a patient need, as we said? Or is it a hospital need? Nowadays it's a fad. Me being a doctor, I'm saying that we have a fad towards gadgets. Most of the newer mobile phones, iPads, or anything is being carried by the doctors or the surgeons. Or is it a fad to have a telemedicine system in the hospital? Or is it just a support or a convenience to the medical staff? So where are we? What is the actual vision of that organization, of an hospital or a organization which is implementing telemedicine? Where is the need? We are talking about in the rural healthcare, we are talking about lack of doctors. Every time there is an news saying that there are 6 lakh doctors shortage in India, and the recent NRHM studies have said that they started mainstreaming Ayush doctors. And then the primary healthcare centers in India has a shortage of only 10.2% of doctors. Like say 2,000 doctors are just shortage. I've traveled extensively implementing telemedicine with neurosynaptic in India, and every village that we go to, there is a doctor. I'm not saying a qualified MBBS doctor, but there is a healthcare provider there. And when you implement a telemedicine solution in that village, the first and the foremost competition or the barrier that we get is from that local quack, as we call it as, or a doctor there. Are we taking him into consideration? You set up a telemedicine center in a village, and then what you get is none of the patient turns up there saying that, I go to that doctor. He's physically present. What he gives, what's the quality he prescribes. He gives steroids for a small fever, or even he might prescribe an antibiotic for a migraine. That's a different question. But the patient would want to access a physical doctor there first. How are we dealing with this? One of the solutions One of the things Neurosynaptics, along with the World Health Partners, did was to have the doctors, these quacks themselves, be a part of the whole healthcare delivery mechanism. Not that we are recognizing them, saying that you are a doctor, but can we restrict? There are OTC medicines where I can go and buy it myself, but can this quack just prescribe the OTC medicines, and for everything else, can he connect to the doctor at the other end? So the business model here becomes pretty critical. The financial considerations, and even if it is CSR model, it becomes very critical. Is there a clear revenue model that we can see in the whole space? Are there benchmark methods to clearly measure savings? If you're talking about, okay, this person, he can. If you're talking about the patient will save so much or the hospital would save so much by delivering healthcare through telemedicine, are there some kind of a benchmarks that we can set, or can we set measures priorly? Is there a strategic contribution to the whole group? If it is in hospital, what is the strategic contribution there? And what are the clinical results that we can see if it is monitoring and tracking of these patients? As everyone said, whom? Just in the last session, we were talking about the doctors are the customers and the patient are the beneficiaries. So isn't it required to ensure that there is an awareness created for the doctors of how it needs to be delivered and what it can be delivered? As clearly said, when I studied medicine, it was always...
Sanjay,
Yeah,
sorry for the interruption.
sure.
We are already on the third day, so we need not again talk about the need. To be more focused, what we can say is segment the market as market A, B, C, D. And how do you market for these 4 segments? Just put in your thoughts and ideas in that direction so that they can grasp something out of this. Otherwise, need is emphasized in the last 2.5 days. Now everybody, you touch them, they will tell telemedicine is needed.
Okay, I'm questioning that the way the telemedicine is delivered itself. I know that there is a need in the rural areas. There is a need in the urban areas also. But if you're talking about the rural areas, there is a need. Everybody says, but I'm questioning that if there is a physical doctor available there already, how do we tackle that? That is a marketing question that I'm addressing. Can we tackle a physical doctor, the so-called doctor, as a quack that is being there versus the telemedicine?
And again, sorry for the interruption.
Sure.
Do we have to repeatedly use the word quack by the Indians itself? Because there are so many, at least they are paramedics. Some outsider may be using a quack. But are we not denigrating and belittling our own people by putting everybody in the villages as a quack? That is only my wise suggestion. We should not...
Sure, I agree with you saying that everybody is not a quack, but for me there is a care provider. We can probably use that term, and yeah, local paramedic or a care provider in that village. How are we going to tackle that issue in marketing telemedicine in the rural areas? We, as I said, one of the solutions is to involve him itself in kind of delivering care. Can we, instead of competing with him, because faith and trust is the most important factor in healthcare. So if we compete with that quack, and in the village politics, it's not going to help us. At least in my experience, it's not going to help. We got to involve him, the care provider in the village, to deliver care. And similarly, in the urban scenario also, we say there's a requirement of family physicians. The primary care in urban scenario is very less, and that's where telemedicine can be used. Home care is where telemedicine can be used. But again here, as we were talking about creating awareness amongst the doctors, how many doctors would still say after the telemedicine consultation, say, you need to come and see me? Are they aware enough saying that only 80% of them actually requires a physical touch for a consultation? There's a complete lack of information. If you're talking about telemedicine device companies going and selling it to the hospitals and the doctors, they are trained on how to use this, but there has to be an amalgamation between what can be delivered through telemedicine. That is what is missing. That information is what is missing. There is a lot of pilots that happen, but can we aggregate the results and say that this is what can be delivered through telemedicine without a physical touch being happening? That information dissemination is what is missing in the whole marketing of telemedicine solutions in India, is what I see. And so as the patients. Patients would always agree upon the patients would always agree upon what the doctor would say. He says, okay, come and see me through the telemedicine network. Next time they would surely agree. But convincing the patient for the telemedicine consultations is by the doctor. So we got to look at creating awareness there, and information dissemination of what can be done through telemedicine is more important than going and telling them the features of the products that you are selling. Just a couple of slides on what is about implementation. As we talked about the doctors who are skeptical and patients who are skeptical, the mantra is simplifying care through the successful telemedicine implementation. Thank you.
We can take some questions if you have for Sanjay.
Yeah.
Hi, I'm Manish. I'm from West Bengal, and particularly I was very much interested in this particular session because in West Bengal I'm planning to have a telemedicine center there in my locality. Now, there are two key areas which flag up as what you have said. Well, when we come to the rural area, you pointed out like we can involve the local healthcare providers in mainstreaming them in the telemedicine network. And how to do it? This is how to do it. And again, if we have to do it and get the patients or people who require healthcare services, in that case, how to get them convinced. How can, my personal request before Telemedicine Society of India would be, how can TSI be helpful and crucial in raising the awareness in society, specifically at the rural level, in getting the people understand that telemedicine could be helpful, and also how can alliances like Continua, we have been talking about, is this and can be taken up as an agenda for national or international alliances in raising awareness at at the level of rural areas as far as India is concerned. And if we come up to, if we see the urban or semi-urban population, where, as you said, rightly said, that primary health is an issue, well, in that case, we would require innovative ideas like as Mr. Anish Chopra came up with like a healthy individual contest. Now, I think where, again, alliances and TSI, where various agencies are a member, yeah, I think, in fact, I would be looking forward for such helpful information, such contests in which, in any way, by which people could be involved, and will have to look separately for urban and rural areas.
Is there a question for me?
Thank you, but for the lack of time, we will take it as a suggestion,
Yeah.
stroke comment, and we will see at the end, because none of us need any more explanation or elaboration on that. Please. Thank you, Sanjay, for this good presentation. And sorry if we have disturbed you, but basically what I wanted to say is the third day, as I mentioned, you touch people, they will be bleeding, telemedicine, they will be okay. So we should just tell the solution more than the problem. Okay. Once again.